Now we will move to the symphatolytic drugs. In that, beta blockers. So we start with the beta blockers. The drugs which are responsible to block the beta receptor, they are called as the beta blockers. So that is the general structure of beta blockers. Okay. So this AR indicates aryl group. This is oxy 1, 2 and 3. So propyl with hydroxypropanol, and this is amine substitution. So amine. So this beta antagonist is called as aryl oxypropanol amide. Okay. So they consist of, in case of SAR, if we have to go through, this is the general structure for the beta antagonist. So secondary amine, this is secondary amine NHR. If R is H, that is primary amine, it will decreases the activity, but NHR, it is the secondary amine, it will require for the optimum ac activity. Then at beta position, hydroxy group is there. So this beta hydroxy group, it must be in S configuration. So we have R configuration and S, out of which this hydroxy group must be in the S configuration. Then OCH2 group has been incorporated between aromatic ring and ethyl amino side chain. Okay, so this OCH2 group. Okay, and this is CH2 CH2, that is the ethyl, this is amino. So OCH2 group must be present between ethyl amino side chain and aromatic group. So such case is present, it gives more potent beta blocker. That means this aryl oxypropanolamine is the potent beta blocker. Now this aromatic ring, or the nature of aromatic ring, it is responsible for the ADME, pharmacokinetics, absorption, distribution, metabolism and elimination. So if at the para position of this aromatic ring, suppose this is the aromatic ring, at the para position of the aromatic ring, there may be presence of substitution, it will give the proper activity. But at, this is ortho, this is meta. If any substitution is there on beta position, it will decreases the beta 1 selectivity. So M position must be the empty, so that beta A selectivity will be more. Now if the given molecule is lipophilic in nature, so as we know, if it is lipophilic, it can cross the blood brain barrier, so it will produces the CNS side effects. As it can crosses the blood brain barrier, it will enters into the brain CNS system, and there is also some adrenergic receptors are present. So adrenergic can receptor, so it can block that receptor, and they are responsible to produce the sedative effect or the CNS side effects. Okay. And if hydrophilic drug, they cannot cross the BBB, blood brain barrier, so it will not produce any side effects. As well as such drugs, that is this neurotransmitter, they are having the structural similarities with other neurotransmitter which act on the CNS, so it will produces the sedative like side effect. So these are some examples of beta antagonist: propranolol, pindolol, nadolol. So these are some examples of beta antagonists of first generation.